Hank Aaron is part of the Rebound Buffalo. We are working to make sure that we get answers for you about some of your most pressing COVID-19 questions. All week long, we're speaking with the top health leaders in Western New York for a series of roundtable discussions to make sure those in charge are doing what's right. One big issue facing our local health departments is a lack of funding. They say cuts have made it hard for them to do their jobs even before the pandemic started. This morning, 7 Eyewitness News reporter Olivia Proya is learning more about this growing problem.
Public health departments have faced budget cuts for years, making it difficult for them to fulfill their goals pre-pandemic.
There's not one person on this call who hasn't been severely cut in their staffing over the years. You know, we're not talking 5, 10%, we're talking 10, 20, 30, 40%.
Our allocations coming from state aid, from grants, they keep eroding year by year. And that, has resulted in a lot of us being in a position where, we haven't had the resources we need for just general public health work, much less being in a position to respond to a significant pandemic.
Public health work is invisible. Even though every time you turn on your tap, you flush your toilet, when we're talking disease prevention with the spread of communicable diseases, STDs, family planning, this is all core public health work that people don't even think about, that's been completely overlooked. And that's why it's underfunded.
They were all originally underfunded before the pandemic, and we've had to pull staffing resources from those important programs to respond to the pandemic. And so now now we're faced with, having to go back and try to rebuild many of those programs. And we've really lost a lot of hard-fought battles.
Although we're not going to see much of a change going from 2020 to 2021, we still need to build upon that infrastructure in order to make it stronger for future pandemics that might occur.